Hi, it's Jessica DaMassa with WTF Health, and joining me right now I have Stefan Buttigieg. He is the, thank you, that we practiced saying that name. So he is the co-lead for Health 2.0 Malta, the beautiful Mediterranean country, one of the most beautiful, right?
I've heard that you want to come, right?
I do want to come for sure. So talk to me about what's going on in Malta from a health innovation standpoint. First, I think back up and tell us a little bit about the healthcare system there for those that may not know. What's it like?
So we have a single payer provider system. So the government is the main provider and the paying payer as well.
Okay.
But also we have a number of private hospitals. We also have a private-public partnership in Malta. So we actually have a private company, actually from the US, Stewart Healthcare, who is actually in collaboration with the Maltese government for a period of time having the Maltese hospitals, and at the same time they would manage it.
Okay, so tell me a little bit about the state of play for healthcare innovation in Malta. What's going on right now?
So right now, let's say we're on the attack. But
You're offensive.
We're on the offensive, yes. Because right now in Malta, I would consider us as like an early stage innovation. That means that we have a lot of good pieces in place which were brought about by the government. So the government did invest in digital health. But it is not fully digital. We're still in transition. So for example, a lot of our clinical documentation in the major hospitals in Malta is mostly done on paper.
Okay.
We're getting there, so there's some dashboard going on there, a couple of things taking place, but as such, most of the clinical documentation is still in paper. So we're still there. And when it comes to digital health startups, we are still getting started there. So one of the main reasons why we set up Health 2.0 Malta is we want to kickstart the innovation. We want to put in some ideas in some entrepreneurs' minds and make that into reality. So try to bring up the digital health, let's say, community in Malta.
Okay, so talk to me about some of those digital health startups then in Malta. What do you got?
Yeah, okay. So one of the startups is Umana.
Okay.
So Umana they have the T1 heart monitor.
Okay.
And they actually they have like a tattoo sensor, or what they call as now smarter skin, and on top of it they actually do a sensor. There's also an interesting website, pharmacy.com.mt, which actually shows the nearest pharmacies. It's a really good app and it works, and it's reliable. And we also have right now, we're going to have some startups pitching this week actually, and one of them is actually called Treatment Express Prescription Service. They actually do prescription delivery through a mobile app. That is one of the startups. What else? So you see, that is something that I'm kind of facing, and there are startups, but it's like they're not talking to each other.
Okay.
So now with Health 2.0, we're trying to bring them all under one roof and trying to kindle innovation at the start. That's what we're trying.
That's awesome. No, that's so exciting. And I think, one of the things that you said in describing just even those three startups that struck me is that most of them are I like that they're mobile based. And so one of the things I feel like, I do feel like in a lot of situations in Europe, it seemed to me like healthcare consumers are okay with doing things on their mobile phone related to their healthcare.
They do it already,
yeah, they do it already. So, talk to me, I guess, a little bit more about some of the things that make European healthcare consumers or consumers in Malta different when it comes to healthcare. Like, what are they like?
I think there are different motivations. So different countries have different insurance provider models.
Right.
So for example, you can have in the Netherlands where you have more, which is government, but more private. So they're more motivated.
Right.
Right now, for example, in Malta, we have a high out-of-pocket payments.
Okay.
So people are getting out cash. So the money actually just keeps going in a very small circles rather than going to bigger companies or going to the government who can reinvest in technology. So until we solve one of that challenges, it's going to be a bit more challenging to invest in technology.
Okay.
Because the value might not be seen straight away. But I think as we develop, the government is realizing, even now Malta is actually being known as the blockchain island. So actually I see a lot of potential for companies who are using distributed ledger technology to come to Malta and do even blockchain in healthcare, this DLT healthcare. There's so much potential there.
So talk to me a little bit about that. Are you seeing any blockchain healthcare startups in Malta?
Not so much
Not
right
so
now.
much
Not
yet.
so
Okay.
much. But please come to Malta. We welcome you. We love you. We want you.
Tell me a little bit, I guess, how big is Malta? How many people live there?
Yeah, so it's like 430,000.
Okay. So it's a tiny market. But that doesn't mean that it's a not important market.
No, but tiny market means that it's easier to deploy your solution. So I see
right.
Malta as being the test bed of innovation. Definitely. So if someone who is a bit scared of going into 4 or 5 million, you can come to Malta and talk to us. We can create something together. and actually you can create a pilot, for example, which works well. And even interestingly enough, taking into consideration our history, we have like a diverse genome actually.
Okay.
So that's
there you
something.
go.
So that's something also interesting, and providers or digital health startups can actually come to Malta, try out their apps here, see what works, see what not works as well. And at the same time, also Malta and the Maltese patients actually benefit from this because they
Right.
have access to technology.
So what's the sentiment, I guess, about innovation in healthcare? Are the providers, are the doctors very receptive? Are they open to it? Are the hospital systems open to it? Is the government open to it? What's the feeling about it? Are people excited, or are they afraid, or what do you think?
There's a mixture of both, right?
Okay.
So that's very natural. Being a doctor, you sometimes just want to keep going on your workflow, don't really want to change the workflow. So there's a lot of enthusiasm, but I believe that there's no clear pathway to innovation. So it's not clear to a doctor, like if I want to do an innovation, where should I go? What should I do?
Right.
What if I want to ask for it? There's that process which is not clearly defined. Once we could define that in a clear way, I think there will be an acceleration for innovation.
Right.
So that's what I hope. And actually, one of my dreams is actually having an innovation center just next to our hospital in Malta. That's one of my dreams. But we'll see what happens. We'll
A beautiful place. If anybody's looking to set up an innovation center,
come to
I'm
Malta.
gonna have to go. I've been invited now, so thank you.
You are, yeah, we've done Twitter, and now we'll do it officially. Yes,
There you
invite you
go.
to Malta.
Thank you. Finally, I've been invited to Malta. Well, I look forward to coming to see you in your native home country, and I can't wait to hear more about all of the exciting things that you're going to do there through Health 2.0 to bring innovation into
And you
the
know how I
scene.
spell it to you? Saha,
What is that?
health in Maltese.
Beautiful. I love it. Well, thank you very much for joining us, Stefan. It's always a pleasure to talk to you. I'm Jessica DaMassa here at Health 2.0. Thank you for joining us. This is WTF Health.